We're here at HIMSS 17 talking with John Kansky, who is the president and CEO of the Indiana Health Information Exchange.
Correct.
Also on the board of directors for HIMSS North America as well. John, thanks for speaking with us today. You know, when we're talking about the current state of the exchange of health information, several competing approaches going on right now. So let's talk about those approaches and why they're kind of at odds.
I don't really characterize them as at odds as so much as I feel like this is the American way that we figure things out. There's multiple approaches trying to do some of the same things, but at the same time there are other value propositions that the different approaches are better at. So I really think we're in the process, we're at the leading edge of just figuring out what's going to work in this country, and the different approaches are going to help us figure that out.
Should those different approaches be able to mold together, or is it just going to be a matter of a couple of them drop out eventually?
Well, it's to try and crystal ball a little bit. I think it's a complicated enough problem to try and make the healthcare system interoperable that we're going to need more than one approach to get all of the different use cases accomplished that the healthcare system needs. So in the end, all the interoperability approaches that we're aware of now may not still be names we're talking about in 5 years, but at the same time, I think that these approaches will have turned into a amalgamation of ways that individual organizations figure out how to meet their interoperability needs.
What do you think are the takeaways from each model that make them workable or make them good, that you want to have in a successful comprehensive model? You know, what are the parts that you sort of drag in from each one?
Sure. I mean, I think the EHR vendors are they're always going to have a important bond with their customers, and that's the place where the clinicians' eyes are going to be, and the EHR vendors have to own that space and help make the data available, versus the HIEs and HIE as a national organization of HIEs are in a position to have the relationships within their markets and their regions, and aggregate the data and do things that are better suited for those kinds of organizations.
Speaking of the individual exchanges, let's talk about HIE and the strides that your organization has made, you know, in the last few years towards successful exchange of health information.
Sure.
Yeah.
So HIE's been around for 13 years now. That makes us pretty old in HIE years. Very recently, we're focused on a strategic plan that really includes three things: how to support our market and our customers for population health, how to integrate well with our customers' electronic health records. As we mentioned a moment ago, that's a really important platform and application for our customers. And the third is really the new thing that is, I think, telling about where health information exchanges as a nation, is we're acknowledging that we have to figure out how to do interstate and inter-region exchange of data, and we're actively working on that.
I was just going to ask you, you know, if you could pinpoint some of the lessons that HIE has learned on its way to success. You know, what would be the ones that you highlight for other exchanges that are making their way, but not quite where HIE is? What have your successes been, and what can they foretell for other exchanges? I'm
going to acknowledge kind of the bias that there's different ways to be an HIE, and IHIE's approach is to run as a not-for-profit business. And there's HIEs come in a lot of different flavors, but we just feel like the secret at the end of the day is that if you're doing something of value for the healthcare system and can provide that as a service at a price that is below the value, you can help the healthcare system and be a sustainable organization.
Is there something about the mission of the exchange of healthcare information and interoperability that lends itself more to a nonprofit model? Should it be a nonprofit, or should the exchange of health information be a profitable activity? What are your thoughts on that?
Yes, I think so. Sustaining a health information exchange is challenging enough financially than to add the need for profit margin or the wrinkle that is created by stakeholders and having to worry about shareholder value. That doesn't mean it's impossible. Again, acknowledging the bias that we are a not-for-profit organization, I think that forget about that. I think there's times when having that mission where all you have to do is get up in the morning and figure out how to make the healthcare system better, that frees you up to do what has the greatest value.
Mr. Kansky, thank you so much for your insight here. You are watching HIMSS 17 TV.